So now I have the distinct pleasure of introducing our keynote speaker, former FCC Commissioner Mignon Clyburn. She is not only, has been a fantastic representative, at the FCC, but truly an inspiration in speaking out for so many different communities that are in need of a voice. She has done amazing work with Digital Divide and tribal nations and education and those who are incarcerated, really trying to bring everything that we have about broadband and telecommunications and connectivity and equity to the conversation. So truly, she has done an amazing job at the FCC, and I am thrilled to see what she continues to bring to the table as she continues, I'm sure, in being an incredible voice for those who can't always stand up and be heard. So, and I happened to be, I'm sorry, one more thing. Last Thursday, she was recognized as the Everett C. Parker Lifetime Achievement Award from MMTC, so I had the pleasure of being with her last Thursday in DC. So please, everybody, give a really warm welcome to just an amazing advocate, Mignon Clyburn.
I'm sure the person's not missing this one. Good afternoon, everyone. Okay, I know we fed you, but we're going to try that again. Good afternoon, everyone. Thank you. I want to, again, express my gratitude to Rebecca for such a generous introduction, and thank Deb for allowing me to join you here. And I want to begin our conversation with a clear, this will be a conversation at lunch, with a clear, simple statement. Our communication system is special. I open with this declaration for two reasons. First, because I fear we take that fact too much for granted. And second, and this is critical, we should never take that fact for granted. Because what this system carries is often intensely personal, but sometimes difficult to quantify. In an instant, these networks put our voice in someone's ear, our face before someone's eyes, transmit our thoughts or ideas to one person or many. They bring us to school, to the doctor, to the bank. They deliver goods, provide us services, usher us help in the case of an emergency, connect us to news, enable our leisure, and immediately give us a presence in just about any community in the world. For better or for worse, these communication services seem less like a tool and more like an extension of ourselves. But the communication sector does not just intersect with every other critical sector in our economy, society, and democracy. It is inextricably linked and intertwined. Be it healthcare, education, energy, agriculture, commerce, governance, civic engagement, labor, housing, transportation, public safety, they all rely on this modern communications infrastructure. And any weaknesses or shortcomings, systemic or isolated, will have a ripple effect that can be difficult to discern, but unmistakable in its impact. While it is important to ensure sound communications policy at every level, we should view all of these efforts as a means to a greater end. When it comes to these networks, the greatest benefits accrue, I believe, when we start with those core principles that ultimately define who we are and what the responsibility at the Federal Communications Commission is. The FCC is mandated by Congress, as it is clearly stated in the Communications Act, and it must do everything in its power to ensure that robust, ubiquitous, open, and affordable advanced communication services and networks blanket this country. Without these critical networks, none of the innovation and growth that we ever hope to achieve in any of these sectors will be possible. That is why promoting the deployment and adoption of broadband-enabled services should always be a top priority, because broadband is an essential tool in the 21st century. This also means we must remain vested in our next generation communications networks being reliable, strong, and accessible. The benefits of broadband-enabled technologies are vast, but the challenges, particularly for the economically disadvantaged and the geographically challenged, are many. Those not able to fully adopt are often left behind, we heard this morning. And if this is not appropriately addressed, those individuals may never be able to catch up. But with the right balance of smart, targeted FCC, state and local policies, public-public, private-private, and public-private partnerships, communities currently on the wrong side of the digital and opportunities divide can be positioned for boundless success. This means we cannot narrowly fixate on infrastructure bills alone, because if you build it, they will come. Only happens when a person can afford the service. There must be a mix of broadband access, digital literacy, and affordability programs, and these efforts will only be successful if they are homegrown and needs-driven. Currently, the FCC defines broadband as 25 megabits per second download and 3 megabits per second upload, but there are still an estimated 30 million Americans without access to these speeds. This is why the FCC must never stop reforming our nation's universal service programs, because it is key for all Americans one day having access to advanced broadband-enabled services. However, this must be done with the needs and objectives of our communities in mind. For instance, when it comes to intelligent transportation systems, if cities deploy spectrum and assets to support these systems, they could at the very same time supply those communities that are faced with high rates of diabetes and obesity and low rates of access to broadband with a cost-effective transportation infrastructure, which will enable those very same patients to get back and forth to medical facilities to address their critical healthcare needs. But while the high-cost fund, aka the Connect America Fund, is closing the digital gap in rural communities, too many urban communities lack access. That is why the FCC should create more incentives for companies to deploy service over fixed and mobile wireless networks to undercapitalized communities. One way to do this is by making wireless spectrum available through auctions. It can cost tens of millions of dollars to acquire one license to serve an area the size of Cincinnati, Denver, or New York City. But the FCC does not require wireless companies to serve 100% of those licensed areas, as we heard this morning. This ultimately results in what I refer to as a donut hole, an area where a licensed wireless company chooses not to serve, in areas where too often most of the residents live below the poverty line. I promise we did not cross-collaborate. It's just a fact. But the FCC has an opportunity in a pending proceeding to allocate spectrum in the 3.5 gigahertz band that could encourage companies to deploy fixed wireless and mobile service networks to serve those donut holes. In 2015, the FCC designed licenses that are smaller in geographic size and should be less expensive than traditional wireless licenses. They are called Priority Access Licenses, or PALs, designed to serve an area that is the size of a census tract. Smaller sizes of PALs, say that area, that census tract area, improve the possibilities that companies of any size can provide wireless service to communities of need, both rural and urban. The FCC has yet to do this, but the concept has attracted a lot of interest from non-traditional companies, which is exactly what Section 309J of the Communications Act intended for spectrum auctions. But the current proposal, which increases the size of PALs, will make it more difficult to achieve this result. So I encourage you to weigh in, because I can do that now. If you believe that communities large and small deserve more opportunities when it comes to connectivity. Deployment, as we've heard over and over again, is just one part of the broadband equation. And filling a donut hole with wireless service or connecting fiber, house to fiber, does not automatically mean that service is available to that consumer. What if the monthly cost, as we heard, $60, $70, $80 a month? What if that is too high? What if residents do not have a computer or mobile device? Because there are 5 million Americans without a telephone today. What if they don't see the relevance of broadband in their lives? Well, the FCC's Lifeline program, which you heard about, is an attempt to address and close the affordability gap. E-rate seeks to close the gap, and those schools and libraries that offer digital literacy programs at times when communities can access them, not 9 to 5, when communities can really access them, are narrowing the gap. But strangling the Lifeline program, the only means-tested universal service program that directly addresses the cost of voice and broadband service, as is currently proposed by the FCC majority, will only ensure that those who cannot afford service today will not be able to afford service tomorrow. And in the midst of all of these existing challenges lurks another consequential transition. That's the transition of our current wireless telecommunications networks to the next generation standard, or 5G. The promise here is greater speeds, which could allow us to transfer more information and data, less latency, which could bring about fewer delays when it comes to that transfer of data, and the ability to connect more devices, which should yield greater network efficiency. I, like you, see this next generation standard as a prime opportunity to apply the lessons we have learned from previous transitions to now. We should strive to get things right from the very beginning of this rollout. And while 5G is absolutely critical when it comes to innovative new technologies and networks, such as the Internet of Things and smarter cities, as well as technology that will help unleash the next wave of smart grid features and efficiencies, leaving behind those areas that are rural or have low net worth would be a tragic error. By allowing many unconnected energy-consuming devices to be integrated into the electric grid through low-cost connections, 5G promises to enable devices to be more accurately monitored in order to support better forecasting of our energy needs. This could revolutionize energy grids and create innovation in energy delivery, choice, and efficiency. However, these benefits, including those potential cost savings to us all, must be ubiquitous if we are to collectively benefit. So as we auction spectrum and facilitate infrastructure bills, reform universal service, and continue to debate net neutrality, why not seize the opportunity to leapfrog the status quo when it comes to competition and deployment? I have said this many times before, and I get no comfort in repeating this. There are too many in our communities that are still waiting for a 3G or a 4G future, while we seem to be talking a lot about 5G. Can you imagine what our nation would look like if the FCC would make policy choices and the industry would make investment decisions that quickly bring every community up to speed? Remember now, nearly half of the communities in this country have one or fewer high-speed broadband providers, so the lack of competition remains a significant barrier. What if the FCC were to auction off 5G spectrum in a way that promotes more robust competition and incentivizes new competitors in markets all across this country? What kind of future would this mean for each of us, where opportunities abound, regardless of where we live, work, or play? I say a bright one, but only if we make the appropriate connections. Thank you.
So I am thrilled to be sitting here with you today. You know how much I appreciate the work you've done. Having spent time working in cities around digital inclusion and seeing the direct impact lack of access has and the change when access is available, I really appreciate your comments on this. And so we are going to make this a true conversation. So I'm going to start with a question, and then I'm going to ask you all to feel free to jump in with some questions. But my first one is, we heard Francella this morning talking about the changes in Lifeline that are being implemented. And recently there were changes that impact tribal nations. And so for the folks who are either in the audience or listening online, what suggestions do you have for us around how we can better support tribal communities?
Well, one of the things that is clear that we know is if we were to go back 2 or 3 technology evolutions ago, that describes what's going on tribal lands. You just see, and I believe the deputy to the mayor mentioned it, that what is hardwired in those areas in terms of the lack of opportunity really gets doubled down, it doubles down when it comes to the infrastructure that they do not have to move to the next level. I think we need to collectively do a better job, and most of you have heard me say this, of making the business case for connectivity. And when I say the business case, it doesn't matter how small or large a community is. Because if you, again, looking at Native nations, which unfortunately there are high negatives when it comes to health, and mental health, all across the spectrum outcome, that's where connectivity, where there might be transportation challenges and people not being able to take off in a timely manner, that's when connectivity, the business case should be made for connectivity. And I believe, and this is a little broader, that we need to turn this upside down. Because what we tend to do in this nation, and what agencies like the FCC tend to do because of what we do in this nation, is look at the upfront costs. What we don't do appropriately is look at the avoided costs or the opportunity costs. Because what would be the avoided costs of somebody not having an episode, a medical episode, and going to the emergency room? What would be the avoided cost of that if they were connected and able to have an ongoing communications with their medical professional, be it psychiatric or otherwise? what would be that added cost if if there's not a library near you to have connectivity to home and learning does not stop, or learning happens because there are many Native communities, even though there might be schools, the children don't have a means to get to the school. And so there are high absentee rates. So I feel that we look at this incredibly wrong-sided, because if you just look at the billions of dollars it would cost to erect or fix or connect, and don't look at the billions more by multiples of dollars that is costing us by way of emergency room care and low educational attainment and the like. If we don't look at that and factor that into the equation, we will never get to where we need to be a country that thrives. So I really think we need to make the better case of what the lack of investment, how that is hurting, what that is not encouraging or enabling, what that is stifling, as opposed to what it costs up front. This is a down payment we need to make for a larger return. And I really, with all due respect, and you are doing marvelous jobs, we need to do a better job of being succinct and pithy about making that case, because only if we make that case will we get the returns that we need.
Wonderful answer, thank you. So we're going to jump right to questions. So if you have a question in the audience.
Oh, no.
Hi, Commissioner.
No.
No, I think,
Plus, because I owe him a phone call, a message, and okay. How are you?
no, I think you'll like this question.
Okay.
All right, I'm John Windhausen with the Schools, Health, and Libraries Broadband Coalition. Chairman Pai and Commissioner Carr, I believe, just announced a new Connected Care initiative in order to provide some funding, a pilot project for connecting doing remote home telemonitoring, which
Yes.
I think is exactly the kind of thing that you've been talking about, you've been working on for many years, I think, with the Connect to Health Task Force at the FCC. So I wanted to just ask you, what do you think of that new proposal, and isn't it a shame that it didn't come out earlier when you were still at the commission and you could have got the credit that you deserve for it?
So the fact that you even put that out there brings me joy. Thank you. So speaking of down payments, one of the things that I am proud of is under the previous administration is establishment of the Connect to Health Task Force, because that task force, recognized that there were powerful synergies at the intersection of broadband, health, and technology. And that particularly in this community, you would be scared, and you probably know this if you, unless you have a concierge physician or you're friendly with your doctor, how few number of physicians we have in this country to support the needs of 330 million people. The numbers are really low. And how few other support health staff that we have in this country to support. So technology, connectivity, telemedicine, telehealth, that's going to be the key. The mobile device is going to be the key because it's the most ubiquitous device that we have. And so I haven't read all of it's just 22 pages. I'm so ashamed with footnotes. I haven't read what is a notice of inquiry, but you should. I will. But if you haven't, you should, because you should weigh in now, because it's NOI. And it is very broad in terms of, if I did read the fact sheet, I cheated. It's starting from the beginning. It's looking at how it should be designed, what the budget should be, what these pilot types are, what the experiments, the type of equipment. It's starting from scratch. And that gives all of you the opportunity to create or have a hand in creating the ideal programs, the structure that will address the needs of the communities. Because the number one thing that, if I'm to remember this properly, the number one issue that puts most families that are not already behind the economic a curtain, that don't have economic challenges, the number one thing is healthcare. A sickness can wipe a family out. And so when you have the means to not only get well but to stay healthy, and it's a means that will not require you to take all day off from work or inconvenience another family member and the like, this pilot has the potential to do that. So I'll be quicker with my answers. But health and technology, to me, would be the key. It's one silo, one element, but I think it's the key for a stronger economic future. Because if you feel better, you will work better, you will earn better, you will learn better.
Thank you. And I will say, if you have not replied to the FCC on a notice of inquiry or an NPRM, we do have a really easy step-by-step little cheat sheet on our website that will help you know how to do so. It's actually not hard to do. You can do it as a city, you can do it as an organization, you can do it as an individual, and your voice really matters. Other questions?
I'd like to take you up on your offer to have a conversation.
You're not the gentleman that's going to speak all long. Who's that? Was that you
That
that
is-
sat down?
That is not me.
I know. I thought the person had facial hair, but
But as an attorney, I can.
please don't.
I have been practicing before the commission for over 30 years. And what I've noticed in the past, say 5 years, so certainly during your tenure, is a change at the commission where today you've talked about some big picture items, but we can no longer get the in-the-weeds items done. It takes so many months to get the silliest of rule changes passed, particularly for public safety, that it takes us 4 years to do a rulemaking to allow firefighters better access inside buildings is frankly criminal. What is your recommendation as to how we can get these items that are literally sitting on the chairman's desk moved forward?
There somehow is going to have to be a better rapport with industry. With all due respect, when it comes to some things that indoor location accuracy and the like, when I tried to get that truncated in terms of the time horizon, well, I can say this now. Why am I hesitating? It was industry. Well, I don't have a job, but it was industry. That stood in the way. And so we need to show, again, the benefits of expediting these. The benefit to me is obvious in terms of public safety, life, and again, what we care about, what the FCC's part of its mission, one of the 4 pillars that it's supposed to govern itself by. But you just mentioned it. That is not necessarily the winning formula. We just have to find a way to make it attractive for industry to move forward. If not, I fear you're gonna have the same time horizon in terms of getting things done on those critical issues. Not a magical answer, but it's the answer.
Thank you. Going back to telehealth for a second, we know in the Commonwealth of Pennsylvania, the opioid epidemic in the aggregate costs the state $23 billion. It's close to $2,000 per capita, and it equals 3.21% of the Commonwealth's GDP. Enormous numbers. And there's a lot of money that's going towards that. If you take an opportunity like that, where we've been able to quantify what addiction means, at the FCC, are you aware of any studies that have been made similar to this for digital divide types of issues? What does it mean to not have access to high-speed broadband? How do we quantify that for states and for communities? What's the cost of not having high-speed broadband?
So the example that I'm not going to directly answer your question because I'm a PK, a politician's kid, and so we don't directly answer questions. But you made me think. It's inherited.
Well, I'm a
we-
publicist, so I can appreciate
okay.
that.
But you made me think about one example that's extremely close to home. When we, meaning the FCC, they now, instituted their rural broadband pilot project, one of the awardees was a Palmetto Health Initiative in my home state that the Medical University of South Carolina got about $7.34 million for that. And it looked at its telepsychiatry silo or initiative alone. It saved over the course of the first 18 months $15 million to the Medicaid program, so it already paid for itself just that one program. I'm not looking at the neonatal and the other programs. So there are examples all across the country because those pilots, and there's 30 plus some odd, had to write reports where it justified the investment and the outcomes. I think in some ways, because they're doing innovative things in those clinics and with those rings and leveraging, there are a lot of anecdotes that you could see that these types of initiatives are paying dividends. And I mentioned that because you mentioned the opioid crisis, that not only part of that $15 million in savings was people keeping their appointments because they didn't have to go out of their homes, or the stigma attached, as you heard earlier, to psychiatric services. So what this has enabled is a personalized approach without giving me that last, and I'm just going through someone else's lens, not that I think there's dignity that someone does not want to go into an office that says psychiatry. Because in certain communities like mine, there will be no comfort if someone knows that you are seeking help, unfortunately. These are the types of things where you can, that what you're saying, that we can find quantifiable information to justify that, and we can talk about more, but you just made me think about that example, and it's life-changing. We've got hard data to prove the benefit of those investments.
Thanks. Other questions?
Thank you. I guess former commissioner.
That's what I hear.
Okay. A couple of years ago, you were on my Gigabit Nation radio show,
Yes.
and we talked about having some sort of way for a community to have greater impact on the decision making of where money goes that goes through the CAF program. And I'm wondering, now that you can speak freely, is there ever going to be a point when communities can indeed insert themselves into the process of determining where this money goes that's supposed to be there for broadband, and what might be, what might the communities need to do to make their voices heard?
Well, one little avenue comes from the NOI that was just mentioned, because if by chance in the communities, if you can create your own type of a network or some type of combined, collaborative type of framework, and introduce a project or a pilot or a program through this NOI, to me that's a means of making a very concerted step in that direction. One of the things that we can do, get better at, is looking at as significant and as difficult and as barrier-laden as they might be, the infrastructure that we currently have, how can we navigate those and help disrupt those to achieve our means. An NOI is, to me, is a prime opportunity to do that, because again, it's not a notice of proposed rulemaking. It is green, territory. It is territory that is ripe, and so I think opportunities like that happen more often than we know. We often don't find out about them, but this is one where if the proposal is novel enough, will not only get the attention at the national level, it should get attention, back home, that hopefully could spur different types of private maybe partnerships at home. So I think taking advantage of these opportunities have a potential of a double positive in that it's out there, you've got support, and somebody else might see it. And if it doesn't get funded or picked up or embraced on a federal level, something else might happen at home.
I just want to make a quick comment,
Who's talking?
a note
Okay,
of
there you go.
thanks.
Okay.
Speaking out in favor of incarcerated families and making that such a huge point, I think should give everyone hope today that people in public life can stand up and do the right thing, even though there's very little political reward for it. So thank you very much for that.
I appreciate that. I thank you so much. One of the things when we talk about how do we get those who are currently on the undesirable side of the economic divide to the next level, when it comes to the unjust and unreasonable and unfair rates that people pay to stay in touch with about 2 million people who are currently, 2.2 million individuals that are currently incarcerated, one of the things that we don't talk about is what happens to those at home. Usually the person that's incarcerated is a breadwinner, which means not 10, but upwards of 70% of the income is gone from that household. If the person is lucky enough to be the one of 700,000 released each year, right off the top, 40% of, usually it's a him, of his income is evaporated because of that record. So when we talk about just being in touch, and it costs families so much, you're extracting what's not there, which means kids go hungry, grandmothers don't take meds, people get evicted. They are 3 times or so more likely to go financially bankrupt. Now, they're already bankrupt, but really financially destitute than the rest of us. And so this is when you see that a simple fix could have a positive economic ripple effect on our economies. And that's one example that I'm passionate about. But everything that we're talking about today, dealing with connectivity, dealing with ensuring that people have 21st century tools, that helps psychologically, emotionally, which I'm separating from psychologically, emotionally, that helps in terms of ensuring entrepreneurship and every other positive down the line. And so for us not to look at reforming and ensuring that our markets are fully functional, which the inmate services, that it is not a functional marketplace. Even the chairman will admit it's not a functional marketplace. But what do we have? What are we willing to do about a marketplace that's not functioning well? The FCC is supposed to act when a communications infrastructure is not fully functional, appropriately functional, but honestly, it has failed to do so. And so thank you for bringing that up. But everything we're talking about today, I believe that we need to look at, and I'm being repetitive, as a down payment, an investment on something that will bring incredible dividends for all sectors of our community for days to come. And I think there might be one more. And I know this person
Last
too.
question. Thanks.
Hi, Mitzi Herrera, the gentle lady from Montgomery County.
American
is the- So I want to ask you the same question that I asked Blair today. You have the experience of being a politician's kid when we actually got deals done in Congress.
Yeah.
You've worked in a state regulatory environment. You've been at the FCC. To the extent that there is evidence that shows that some of these policies are working, some are not, that if we focused on the right things, we could get things going, and that we've got evidence. What is the most effective way to make that case? Or is it simply that it's on purpose, we're not going to listen to whatever evidence you've got, and you have to find a way to get different decision makers?
So I'll try to be quick, but it's not my nature. Sorry. I went to a meeting, and this is going to get out, and this is going to mess me up, but I'm fine. It's never stopped me before. I went to a meeting on the Hill with a particular lawmaker, and I was very anxious, not so positively anxious, because this person is totally on the other side of the political spectrum. And I was like, oh my gosh. And it ended up being one of the best meetings I ever had, and let me tell you why. I went straight into telehealth and telemedicine and all of the benefits and why I think it's so important and critical. And that man said to me, which lets you know it's a man, said to me that if you can show me something that scores high with the Congressional Budget Office, you've got my attention. That's why you continuously hear me say, I mean, I know I'm like a broken record in this. We've got to make the business case for everything we do. You've got to show the positive economic upsides or dividends or payables or deliverables to everything we do. It's not because it's the right thing to do. The right thing, honestly, is not in vogue. It's not going to sell. Nobody cares. They do care about their wallets. They do care about if this is going to provide me sustainable returns over time, I will do it. And everything we're talking about today will provide sustainable returns over time. And the one thing that I want to leave you with, because I can talk to Missy anywhere, is that I think the FCC needs to recalibrate and modernize itself more. I believe, as incredible as our universal service makeup is, that it needs to be disruptive. Because the four silos that currently exist, I think they'll make a lot of sense for today. Because if you just look at E-rate, or you just look at Lifeline, or you just look at high cost in a vacuum and don't recognize that there are other ways it could leverage and be appropriately allocated to address multiple needs outside of that one silo, then I think we're missing a lot of efficiency, potential for efficiencies. So I contend that the current silos that we have do not make sense in the 21st century. I contend that we need to look at the universal construct, universal service fund in a universal way, not in a siloed way. And if we do so, we will leverage efficiencies, and I think we will bring about positive dividends quicker to all sections of this country. The FCC needs to reinstitute, reconstitute, recalibrate itself, and those of us who are influencers in this space need to ensure that that happens. Thank you.
Thank you. That was wonderful. I have to say, I really, as always, I appreciate your candor and your humor and your passion, and we are very happy to have had you here with us today, and I'll appreciate it if we could all give her a hand.
My pleasure. Thank you.
So what happens next? We're